1 in 5 people in the world lives with a mental disorder. In the US and Europe, this amounts to 150 million people. The social and financial impact of mental disorders is greater than that of cancer and diabetes combined and amounts to 4% of the GDP in Europe. This is only to be exacerbated by the COVID-19 pandemic. Since its inception as a medical practice, psychiatry is focused on treating symptoms and behaviors rather than the proven underlying brain processes. Existing mental health therapies show limited efficacy and severe side effects.
As founders of GrayMatters, 5 years ago, we learned about the biomarker-based technology developed by Professor Handler and her team, and have patiently waited for the technology to mature to what we believe can revolutionize mental health.
Thousands of studies using fMRI demonstrated that mental disorders such as PTSD, major depression disorder, and borderline personality disorder are associated with abnormal hyperactivation of the amygdala, a brain region responsible for threat response and emotion regulation. However, no device, drug, or therapy targets the amygdala. Over the last decade, Professor Thelma Handler and her team at the Segal Brain Center, Tel Aviv University, developed an fMRI-guided machine learning model for processing EEG signals to probe the amygdala network. The model, termed electrical fingerprint (EFP), uses 8 electrodes EEG to produce a scalable, affordable, and accessible biomarker of human amygdala activation. GrayMatters' first product, Prism, is a self-neuromodulation system using this capability to train patients to down-regulate the amygdala biomarker signal with only EEG. No fMRI is needed. Prism treats PTSD patients in a closed-loop manner by teaching them to use online feedback from their amygdala EFP in order to learn down-regulation. During a Prism session, the patient interacts with an animated scenario, providing feedback about the amygdala EFP signal level. Whenever the signal goes below baseline, the patients receive a positive feedback from the scenario. It's like placing a mirror in front of patients such that they can see their amygdala EFP activity and learn to control it. Therapy includes 15 sessions, each 30 minutes long, spread over 8 weeks. Therapy sessions data is uploaded to the Prism Cloud for future therapy personalization using data-driven diagnosis, treatment protocols, and status monitoring. Studies demonstrated that participants trained to downregulate their amygdala EFP signal were able to volitionally downregulate their amygdala BOLD signal in post-training neurofeedback guided by fMRI. Furthermore, amygdala fMRI activation in response to emotional stimuli was reduced and emotion regulation performance was enhanced, together suggesting target engagement. Importantly, studies with PTSD patients demonstrated significant clinical improvement over time as an adjunct to current standard of care. More than 400 subjects used our technology in a series of studies with no severe side effects. A study with 80 severe PTSD patients showed significant clinical improvement for 36% of patients right after treatment, which grew to 55% of the patients 6 months later with no further intervention. We are currently running a clinical PTSD study in 5 centers in Israel and the US. But we are not stopping with PTSD in the amygdala. We can adapt our technology to target additional regions and are collaborating with some of the world's leading institutions to expand the technology for treating borderline personality disorder, depression, anxiety, and ADHD. Prism for PTSD. Disruptive Digital Therapeutics for Mental Disorders by GrayMatters Health.